Welcome students from Sioux North and Sioux Lookout, Ontario. I'd like to introduce you to Anna Kraus. She is an RN, a registered nurse at Kingston General Hospital in the ER department in Kingston, Ontario. And she's here to talk to you today about her career path in nursing and also some other opportunities that she's had the chance to take advantage of throughout her career. So I'm going to ask the questions of Anna, your questions on your behalf. So first of all, Anna, what type of post-secondary training did you have to complete in order to become a nurse? And what kind of courses did you need to take in high school to apply for those courses?
Hi, everyone. Nice to be with you today. So I guess to answer that question, I had to do a bachelor's degree in nursing to become a registered nurse. And to prepare for that, I think we had to have, high school biology, chemistry, and then, any of the kind of general courses. I went to school actually in Alberta, so it might have been a little bit different, the high school requirements I had, but certainly kind of English, sciences, and I think one of the higher levels of grade 12 math, I think, to go on. That being said, if you're interested in the healthcare field or nursing in general, but kind of aren't sure about a four-year degree, there are other options to kind of test the water out. So as an RN, I have a bit of a bigger scope of practice and more responsibility. And if you wanted to work in an area like an emergency department or an ICU, you would need to be an RN. But an RPN is a 2-year college degree that you can still work in a hospital setting and have a lot of responsibility, but not quite the same degree that we do. But it's something you can test things out. And if you want to later upgrade to an RN, that's also an option with more schooling later on.
Awesome. So good to know that there's a couple of options if you're interested in nursing. So how long was your training from sort of start to finish?
So it was a 4-year university degree, which included courses in the classroom and a variety of clinical placements, both in hospital and the community.
Great. And when did you first know that this was the career for you?
So honestly, not really until after I graduated university and was already working as a nurse. I'll admit that I was pretty unsure of what I wanted to do after high school, aside from something probably involving travel. I found it was pretty overwhelming. There were so many options to choose from, and I did actually apply to 3 different types of bachelor's programs. I think nursing obviously being one of them, international development and languages being some of the others I remember. Because at 17, I really didn't know what I wanted to be when I grew up. I think I chose nursing in the end because it had more science courses, and my dad thought that studying sciences was important. But it's worked out really, really well for me. Even once I was in nursing school, I found I wasn't always sure it was exactly what I wanted to do, because I did find that some placements were a little bit more intimidating than others. But that being said, felt really fortunate that I was able to try so many different things out, because not every degree has the practical placement component to it that nursing does. And I'd always thought I might like emergency nursing, and I kind of had to wait until my 4th year to try it out, and it was definitely the right fit for me. I love being an emergency nurse, working with patients for kind of all different walks of life when they're upset or hurt and in crisis. So I think sometimes it's a bit overwhelming when you're trying to figure things out, but it's a really, really great career.
And how long have you been a nurse?
I've been a nurse for 10 years now.
Awesome. And is Kingston the only hospital that you've worked at?
Well, yes, I guess yes and no. So in my 3rd year, in the summer of my 3rd year, I had an opportunity to work in a children's hospital in Alberta. So I did that for the summer. I've worked in a couple hospitals in Kingston, and then I've also worked internationally in a bunch of different settings and hospitals there.
And you're going to share with us a little bit about that at the end. As an ER nurse, I'm sure that your job changes day to day, but what are the major responsibilities of your job?
Yeah, so it depends on the day. Um, we have different sections of the department and we tend to kind of rotate through them all. So one section is for traumas or more critically ill patients who require a lot more hands-on care and close management. Another section has, an area for mental health patients, women presenting with obstetric or gynecological problems, orthopedic issues, so broken bones or sprains, things like that. Um, Patients that are maybe coming into hospital for things like pneumonias, that are waiting to transfer to the floor. So it's a little bit more what we would kind of say floor nursing, in terms of kind of making sure they're getting all their pills and all the care that they need so that they can get healthy and get back home. Um, and another section is for people coming in, they're a little bit more stable, but you're coming in with an acute problem, so belly pain or confusion, or something kind of in crisis, but you're a little bit more stable than in the critical care area. Um, in Emerge, we kind of see a tremendous variety of cases, from all walks of life, and from patients that are only 3 days old to 100 years old. In Kingston, we don't have a children's hospital, so about 25% of our volume are children. We see infectious diseases, traumas, heart attacks, things that need surgery right away, and even the odd baby delivery, although that's a kind of a stressful situation for us because we're not as used to dealing with that. But it's all in a setting where we don't really know what's coming through the door on any given day. Um, and yeah, we're very lucky. One of the things I love about the emergency department is that we have a really awesome team and we all work together to kind of get patients healthy and back on their feet. And that's a really broad team of doctors as fellow nurses, respiratory therapists, unit clerks, patient care assistants, and housekeepers, and everyone's working together to kind of provide the best care possible to our patients. One of the areas that I really enjoy working in is triage, which is where that's the first introduction that a lot of patients will have to the emergency department. So when you first walk in the door, that you're the first person that a patient would encounter. And so you as the nurse have to decide, I guess, why the patient's here and how sick they are and how quickly they need to see a doctor, because often we have more patients than beds, and it can be a bit stressful sometimes, but I find it really makes me think, and you have to kind of put all the pieces together of why people are here and how they're looking, what their blood pressure might be, and different things to kind of make sure that they're getting seen in an appropriate time and manner.
It seems like a very, very busy job, and I'm sure the days go quickly. What does a typical work day or work week look like for you? Do you work 9 to 5? Do you work shift work? How does that work when you're an ER nurse or any nurse?
Yeah, so I guess it's not, I guess in the emergency department, we work 12-hour shifts, so it is shift work, and that varies between days, nights, weekends, and holidays. We're open 24/7, 365 days of the year. So we kind of have to schedule our shifts around that. That being said, not all nursing requires that. If you like nursing, but you're not sure about shift work, there are nursing jobs that you can work 9 to 5, just less likely to be in an emergency room. And then we tend to work on a full-time rotation. We'll do 2 12-hour days followed by 2 12-hour nights, and then you actually get 5 days off. So you're pretty tired by the end of those 4 days, but then it's nice to have the flexibility with your schedule, to kind of have that extra time off. I think like every job, there's pluses and minuses to the scheduling, but I personally really like the flexibility of 12-hour shifts and more time off.
Oops. And what do you like most about your job?
Yeah, I guess I've touched on a little bit, but I think really I love the variety. There's very rarely a dull day. And yeah, I'm always learning something new every day. and I feel really challenged at work with that, in the sense, and I mean, you can kind of be as challenged as you want to some degree, but we're always seeing patients with new presentations or some, rare illness or condition, or they, come in with really interesting stories to tell you. Sometimes it's just, I had a lovely patient the other day telling me how he's been married to his wife for 70 years, and just kind of having time at the bedside to talk about that was a really nice experience, just to chat and hear about people's lives. And yeah, aside from the kind of the variety of the work, as I kind of mentioned before, we have a really awesome team in the emergency department, and I'm very lucky to work with a really great group of people and learn from them. Yeah, and then I think as a career, I love the flexibility of nursing. For me, emergency nursing, at least right now in my career, is being the right fit. But I'm very fortunate that if I get tired, or I think I might need a change, if I want to become a cancer nurse, or work in a family doctor's office, or so strictly with pediatric patients or things like that, it's really easy to kind of jump around and try those different things out. And then if I don't like it, I can come back to what I know and what I like. And that's something, pretty neat that not a lot of careers have. And I think, we'll talk a little bit later, but I've kind of had a lot of amazing experiences in life because of nursing, and I found it's opened up a lot of doors for me, which I really am grateful for.
And if you would like a change, if you were going to go from ER to pediatrics, would you need to take a special course or something?
So not traditionally through, like, you wouldn't have to go back to university. You would normally have a little bit of an orientation to the new unit, but that would all be kind of provided for by the hospital and paid for. So you would be kind of learning on the job, and you'd have more training associated with that, but it wouldn't require kind of going back to a classroom environment.
Awesome. And what's the biggest challenge at work that you have?
I think it's at least in the emergency department, I find sometimes it can be a high stress environment. And sometimes we do deal with challenging patients, families, and sometimes colleagues. But, people tend to come to us in crisis. Sometimes it's the worst day of their life. And so people sometimes react badly, and that can be challenging to deal with, especially when it's kind of, some of the days it just seems to be a little bit more full on than others. So yeah, I think that can be hard, and you kind of have to learn to manage with that, because it's important to kind of look after your own health so that you can be effective and stuff like that, and not take some things to heart. Sometimes some people might say some things that are unkind, but we just kind of manage and deal with it, and work with a team. And I'm lucky, like I say, I'm lucky having a good team that you can there's always someone to talk to a friend about that, and troubleshoot some of the more challenging situations. But yeah, sometimes it's a challenge of kind of not having a bed to put someone. You have someone sick and you're worried about them, and you kind of have to think creatively and work with your team to kind of find a spot to put that patient, to make sure that they're getting seen and getting cared for.
And it sounds like having compassion and empathy is a really big part of your job, and collaboration. Those are skills that I'm sure you come to the job with, but also develop over time, and really foster within yourself. It sounds like you'd be an amazing nurse. And what advice would you give to someone who is thinking about a career in nursing?
Yeah, so I guess maybe three things I'd say. Keep an open mind. You'll see, hear, and experiencing a lot of different things, and you'll learn a lot along the way. Human behavior is pretty amazing, but it's really interesting, and there's a lot to learn from both patients and colleagues. Stick with it if you don't like. And this was one that was really important to me. If you don't like one type of nursing, stick with it, because there might be something else that you do like, and that's more up your alley. And like I say, it's a really flexible kind of career that way, and so you can try out a lot of different things. And the other one would be to be prepared to work hard, because yeah, we do have really busy days, but I find it really rewarding. Sometimes it's hectic, but the shifts go by quickly, and yeah, it's the hard work pays off, and it's a very rewarding career to be in.
Wonderful. And Anna, you were saying that you have done some other projects and you might have some really interesting pictures to share with the students. Would it be a good time now to show those and to
Sure,
explain about some of those other opportunities?
sure. So let me see here if I can share. So the first photo is actually, as now is kind of the time of coronavirus. The first one will be actually of some of my colleagues in the Kingston Hospital, all dressed up in kind of the personal protective equipment. Oh, sorry, I'm gonna have to quit, I think, Zoom to share those photos. I apologize. I don't know if
Yeah, so you're going to go to share screen at the bottom.
yes, I don't know if it's going to work here. Oh, yes. Okay. Sorry. So I had to quit. Okay. Okay. Great. So this first photo is, this is kind of in our more critical area of our department. This is two of my colleagues dressed up in this kind of personal protective equipment for one of our patients coming in. So all getting geared up and ready. They're smiling behind the masks. You can't really tell. And then in terms of some of the international work, I've been very lucky to, yeah, that's another nice thing about nursing, to kind of be able to leave and go take different opportunities abroad. So the first photo here, this is in Sierra Leone. I was helping set up a step-down ICU at in a maternity hospital in the capital there at their only hospital ward. So these are some of the lovely nurses I worked with. A lot of the opportunities tend to be education. So as you become more experienced as a nurse, there's a lot of kind of development work to go and do and build the skills of nurses abroad. Earlier last year, I was in Bangladesh working in the world's largest refugee camp. They have about 1 million people there. We had a great team of nurses and doctors there providing care to the Rohingya refugees. So this was some of these nurses and doctors. And again, so some of the clinic experiences this is us having a fun laugh, kind of teaching some different orthopedic skills or how to splint a patient for transport to hospital. You have to be pretty creative in these settings because there's fewer resources. And I think certainly working up north, people, you know, as a nurse working up north, you'd be a real expert in those kind of skills and training, because you don't have all the same resources that, you know, you might have in a major center in Canada. But behind here shows a little bit of the refugee camp, the houses there. Yeah, and then other things it can be helping with, this was a health survey in Lebanon, in one of the Syrian refugee camps. So this was us kind of collecting some survey data from one of our respondents. So yeah, I think that's one of the things I just love about nursing, is all the different opportunities that you can have. And if you want to pursue something, generally you can kind of open that door and seek those opportunities out. I think that's it for photos, I'm afraid.
Yeah, oh, those were phenomenal. And just to see you have the opportunity to go to so many different countries to do what you love is quite amazing. So if you want to stop sharing, go to the top and it'll say stop share, because I do have one more question for you.
Okay.
Okay.
Great.
So as if the students are interested in kind of getting a sampling of what it's like to be a nurse, what kind of things can they do in their community to sort of not test the waters, but just to see if they like that kind of environment?
Yeah, so I mean, in our community, a lot of students will often tend to volunteer at the hospital. And so that's a really great way to kind of get inside the door and get a bit of an idea of what the work might be like or how the department runs. So sometimes you're helping maybe get a book for patients, or we have volunteers kind of helping get phone calls for patients, because not every bed in our emergency department has a phone at the bedside. So helping kind of people keep in contact with their family and friends. And yeah, that's probably the main one, would be volunteering. I think is a great way to get inside. Or if you know someone who does work in the healthcare field, I think generally we're all a pretty open bunch and willing to talk about our work. And I think you can, if you can, sometimes our hospital will, there'll be different programs for students coming through. So you can contact the hospital and they might have some opportunities where you could either do some shadowing or go through and do one of these learning programs, certainly as a high school student, but later on, if you're doing some other studies, there might be some other opportunities. So just to get in touch, to reach out and see what there might be.
That's excellent. And I hope some of the students, no matter what career that they are pursuing, can take some of those volunteer opportunities that might be available in their community. So I'm just going to stop the recording, but I just want to thank you, Anna. But don't go anywhere yet, but I just want to thank
Okay.
you for sharing with the students. And I'm sure that you've given them some really great information to think about. So I'm going to stop the recording.